Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update for the week ending January 14th, 2021. As you can see, we have almost reached 2 million deaths worldwide and almost 100 million documented cases, a 4.4% increase in the past week. And as you know, we follow this week-to-week increase because it tells us whether the pandemic is speeding up or slowing down. And early on in April and May, you can see double-digit growth. Then it seemed to slow down to the 2 to 3 to 3.5% a week range. Unfortunately, it's come back up since then. It's now in the 4 to 4.5% range. And at 4.5% week to week, we'll get to 3 million deaths in about 10 weeks. This pandemic is continuing to grow. And what worries me particularly is this cyclical pattern where you saw this increase, significant increase in the number of deaths, daily deaths in April. Then it seemed to slow down. Then it increased again. Then it grew. It's been growing even more than it was previously. And so this makes me very hesitant to make any positive predictions for the future because every time it looks like the rate is coming down, it goes back up again. In terms of where it's occurring worldwide, you'll remember that it started in China. Then it grew very quickly in Europe, that's in the green, then the Americas in orange, and then the last couple of months, both Europe and the Americas are growing very, very quickly. In terms of the most impacted countries in the world, here they are with their deaths per million. The United States is now sixth with 1,187 deaths per million. That's over one death for every 1,000 people in our country. And you can see, if you've been following these presentations over the last seem to go higher in the list, and now they're dropping back down as we see this resurgent growth in Europe. In the United States, we've seen the same pattern, a very rapid growth in March and April. Then it slowed down, then a slight increase in the summer, and then in the last couple of months, again, an even greater increase than we saw before. And you can see this with that little inflection up there since late November. This was sort of a steady growth rate, then it starts going up about here. In terms of deaths, we've had 394,000, almost 400,000 deaths, third leading cause of death in the United States. We had 20,000 deaths last week alone. 20,000 deaths, and yes, they're due to COVID-19. These are excess deaths. A 5.4% week-to-week increase, so about 20% higher than the rest of the world. So the pandemic here is growing faster than it is in the world overall. And you can see this cyclical pattern again, where the rate came down, went up, came down, has gone back up again. It makes me really worry about the future of this pandemic. We don't see this evidence that it's slowing down that I'd like to be seeing. And at this rate of growth, we'll get to 500,000 deaths by February 15th, the middle of next month. In terms of all 50 states, you can pause the video here and look at your own state. There's Tennessee with 1,192 deaths per million. And if we were to compare Tennessee to the rest of the world, we're actually now slightly worse than the US overall, and we'd be a solid top 10 performer. In terms of where all the infections have been, you can see these darker counties are the ones that have had the most infections, and you can see a clustering right here in Tennessee, as well as this odd pattern east of the Rockies. I don't know what to make of that, other than perhaps those are areas that were less dedicated to social distancing and so on. In terms of the last couple of weeks, you can see this explosion going on in the Southwest. Again, this middle part of the country, and of course, a large clustering here in Tennessee. And if you look at our region, again, we're still in the highest part of the range. In terms of regional statistics, if we look at the 4 states, the number of deaths is quite different. But if you look at deaths per million, they're pretty similar, except for Tennessee, which is 50% higher than the other states. That's a topic for discussion at another time. In terms of our regional service area, 8.5% increase, about double the rate that we've seen nationally. At this rate, the number of deaths in our region will double by the third week of March, So the bottom line is, even though we've had vaccines approved, it's going to take a while to get them out. And even once they're out, it's not going to fundamentally change things for a while. The pandemic continues to spread worldwide, approaching 2 million deaths. What we've seen in Europe is very worrisome. They had this explosion in the springtime, then it seemed to slow down, and now they're seeing this second wave. It is coming down again, but again, we don't know how to interpret that in the long term. There appear to be new mutations of SARS-CoV-2. It isn't entirely clear if they're more lethal or more easily spread, or whether they're controlled by the vaccines. At this point, the evidence that I've seen suggests they are controlled by the existing vaccines. They may be more communicable, especially in kids, but that'll wait to be seen. U.S. has passed 1,000 deaths per million, with growth occurring almost everywhere. The rate of growth in the U.S. is higher than it is in the nation, and Tennessee overall and the Appalachian Highlands continue to be one of the most impacted areas, with the number of deaths expected to double by mid-March. So, even when the folks are vaccinated, we're going to have to continue to avoid unnecessary crowds, wear masks, engage in social distancing, implement good hygiene, stay home if you're sick, much more testing, contact tracing, isolation, and quarantine, protecting of the elderly. I was asked this week a question, well, once we're vaccinated, can we back away from these? And the answer is no, not in the short term, because as with all vaccines, there's a certain percent that don't work, that fail. There's also a chance that someone who has been exposed can still be a carrier. And so even when people are vaccinated, until we get a substantial number of folks vaccinated, we're going to have to continue these practices. Obviously, we've been saying for some time, it's time to stop the animosity and the disagreement associated with COVID-19. This is a pandemic. It is not a political football. And it's time to return to a time when we follow the best science possible. There's a great deal more information about COVID-19 on the College of Public Health website. If you know, please let us know. I'd like to thank Barry Young for editing, producing, and posting this video. And as always, one of the most helpful things for me is getting your questions. If you have any thoughts, questions, comments, or concerns, please let me know. I look forward to hearing from you. Thank you very much.